Anesthesia is a remarkable tool in modern medicine. It allows us to perform complex procedures that would otherwise be impossible. But it also comes with risks. That's where careful monitoring comes in. Think of it as your early warning system, a silent guardian watching over the patient throughout their surgery. As an operating department practitioner, your role is crucial. You are the eyes and ears for the anaesthetist. You need to understand what the monitors are telling you and act quickly if something goes wrong. This essay will guide you through the essentials of anesthesia monitoring, equipping you with the knowledge and confidence to provide the best possible care for your patients. Remember, behind every beep, every graph, every number lies the well-being of a person entrusting their life to your vigilance. Let's explore how we can fulfill this vital responsibility together. Anesthesia takes away pain and awareness, but it also affects the body's natural regulatory systems. Breathing, heart rate, blood pressure, these can all fluctuate during surgery. That's why continuous monitoring is so vital. Without it, subtle changes could go unnoticed, potentially leading to serious complications. Imagine not noticing a drop in blood pressure or a slow heart rate. Early detection is key to preventing harm. Our monitors act as our eyes and ears, alerting us to these changes so we can intervene promptly and effectively. By understanding what each monitor tells us and the significance of different readings, we can ensure a safe and successful surgery for every patient. In the next section, we'll delve into the specific tools that make this possible. There are several essential monitors you'll encounter in the operating theatre. Each one provides crucial information about the patient's condition. Let's take a look. First, the electrocardiogram, or ECG, shows the electrical activity of the heart. It tells us the heart rate and rhythm. This helps us detect irregular heartbeats or arrhythmias that may require immediate attention. Next, the non-invasive blood pressure cuff, or NIBP, measures blood pressure, giving us two readings: systolic, which is the pressure when the heart beats, and diastolic, the pressure between beats. We monitor this closely, as both high and low blood pressure can be dangerous. Then there's the pulse oximeter, or SPO2. The pulse oximeter, usually clipped to a finger, measures the oxygen saturation in the blood. This tells us how well the patient is breathing and how much oxygen is reaching their tissues. The capnograph, or ECHO2, measures the amount of carbon dioxide in the patient's exhaled breath. This is a very important indicator of how effectively they are breathing and how their lungs are functioning. Gas monitors analyze the composition of inspired and expired gases, including oxygen, carbon dioxide, and anesthetic agents. This ensures the patient is receiving the correct mixture of gases. And finally, the temperature probe keeps track of the patient's body temperature. Anesthesia can affect the body's ability to regulate temperature, so maintaining a safe temperature is crucial. These are just some of the essential tools that help us ensure patient safety during anesthesia. Understanding how to use them effectively is a crucial part of your role as an ODP. Now that you're familiar with the essential monitors, let's delve into what the readings mean. Knowing the normal ranges and recognizing abnormal values is crucial for identifying potential problems early on. So, ECG. A normal heart rate is typically between 60 and 100 beats per minute in adults. Irregular heartbeats, or a heart rate that's too fast or too slow, can indicate a problem. For NIBP, a healthy blood pressure range is generally below 120 over 80 millimeters of mercury. High blood pressure or hypertension and low blood pressure or hypertension can both be serious if left untreated. When it comes to SPO2, we aim for an oxygen saturation of 95% or higher. Anything below 90% is considered low and requires immediate attention, as it could mean the patient isn't getting enough oxygen. ECHO2, or end-tidal CO2, normally ranges between 35 and 45 millimeters of mercury. High levels might indicate inadequate ventilation, while low levels could suggest problems like hyperventilation or decreased blood flow to the lungs. Gas monitors provide real-time data on the concentration of inhaled and exhaled gases, and any deviations from the set parameters could signal a problem with the anesthesia machine or the patient's breathing. Normal body temperature is around 37 degrees Celsius, or 98.6 degrees Fahrenheit. Hypothermia, which is a low body temperature, is a common complication of anesthesia and definitely requires careful management. Just remember, these are only guidelines. Normal ranges can vary a bit depending on the patient's age, their overall health, and also the type of surgery. As an ODP, you play a vital role in ensuring patient safety during anesthesia. Your responsibilities go far beyond just observing monitors. You are an integral part of the surgical team, and your vigilance is crucial. Before the patient even enters the theatre, you'll be involved in setting up the monitoring equipment. Make sure everything is calibrated correctly and working properly. Connect the patient to the monitors and double-check all the connections are secure. Once the procedure begins, your primary focus is on the patient and their vital signs. Continuously monitor the data displayed on the screens, looking for any trends or deviations from the norm. Be attentive to alarms and learn to differentiate between the different alarm sounds. Accurate record keeping is essential. Regularly note down the patient's vital signs, as well as any changes in their condition or any interventions taken. This information is crucial for the medical record and for informing ongoing care. If you notice any abnormal readings or have any concerns about the patient's well-being, don't hesitate to escalate. Immediately inform the anaesthetist or other members of the surgical team. Your prompt action could honestly be life-saving. Never underestimate the importance of your role. You are the patient's advocate during their time in the operating theatre. Your vigilance and quick thinking can make all the difference. Even with the most advanced technology, monitoring equipment can occasionally malfunction. It's essential to stay calm and know how to troubleshoot common problems to ensure accurate readings and patient safety. Always check for loose or disconnected wires first. A simple loose connection can cause a monitor to malfunction. Many monitors rely on batteries, so make sure they're charged and functioning correctly, and have spare batteries readily available, just in case. Movement or electrical interference can sometimes create artifacts or false readings on the monitors. Try repositioning the sensor or checking for sources of interference. If a monitor is consistently giving inaccurate readings, it might need recalibration. Refer to the manufacturer's instructions or seek assistance from a biomedical technician. Remember, if you're unsure about something or if the problem persists, don't hesitate to ask for help. It's always better to err on the side of caution when it comes to patient safety. As we've explored in this essay, anesthesia monitoring is a critical aspect of patient care in the operating theatre. As ODPs, you are the guardians of patient safety, entrusted with the responsibility of observing, interpreting, and responding to the silent language of vital signs. Remember these key takeaways. Vigilance is key. Never underestimate the importance of continuous monitoring, because even subtle changes can indicate a potential problem. Knowledge is power, so understanding what each monitor does, normal ranges, and potential warning signs is crucial for early detection and intervention. Communication is vital. Don't hesitate to communicate any concerns or observations to the anaesthetist or other members of the surgical team. Stay calm under pressure as technical issues can arise. Just stay calm, follow troubleshooting steps, and seek help when needed. Your dedication to accurate monitoring and your commitment to patient well-being really makes a world of difference. Every beep, every graph, every number tells a story. By learning to read these vital signs, you are playing a vital role in ensuring positive outcomes for every patient who enters your care.